hour of every day. It's a cancer on the rise, oral cancer. It's because it's a new form of the disease caused by a virus, and it's putting women at greater risk than ever before. And the scariest part? You probably don't even know if you're infected. Now, the good news is you can catch it before it's too late. So today, I'm educating you on the warning signs you can't afford to miss, and the most important test you need to demand from your doctor. Oral cancer. It's one of the easiest cancers to spot, diagnose, and treat. Yet more than 60% of these cancers are discovered too late. This stealth cancer can start out as a sore or growth in your mouth that doesn't go away. With early diagnosis, your chances of a cure are a staggering 80 to 90%. Yet 1 in 4 people with oral cancer will die because they were not diagnosed and treated in time. The typical oral cancer patient used to be a smoker or heavy drinker and twice as likely to be a man. Like Michael Douglas, who was diagnosed with late stage 4 cancer last year. But that's the old face of oral cancer. The majority of new cases in this country are caused by the human papillomavirus, or HPV. The same virus responsible for the vast majority of cervical cancers in women. Joining me is my colleague and good friend, Dr. Jonathan Levine. He's a leading dentist and expert on oral health. Also here is Dr. Bert O'Malley, a world-renowned head and neck surgeon and the co-director of the Head and Neck Cancer Center at the University of Pennsylvania. I will give everyone a little warning. If you've got young kids in the room, you may want to send them out, but I want the teens to stick around for this very important but open conversation. I was trained to think that oral cancer was caused by these 2 items, alcohol and cigarettes. I can guarantee you that your doctors were trained the way I was. So if you didn't smoke or drink as a patient, we didn't think much about oral cancer. We didn't think about it as being a major risk factor for you. So Dr. O'Malley, if you can help us with this. The entire paradigm of oral cancer has shifted. I was unaware of how much it had changed until before I got the show ready. Why has it become a disease that young women must now fear?
Okay, so in general, as you mentioned, in the past, it's been heavy smoking and heavy drinking is the reason to get oral cancer. And that was up here. That's decreasing. Human papillomavirus, or HPV, is now becoming the #1 cause, and it's on the rise. So serious that it is truly a 21st century pandemic. Now, it's a sexually transmitted disease, and the scary fact is 50% of sexually active men and women are at risk for this disease. So if you pause and think about it for a second, 1 out of every 2 of us is at risk for HPV infection. And predominant mode of transmission is oral sex.
Oral sex. Are you hearing that? A lot of folks think that's a safer way to go, and we're going to talk about this again in a fairly overt, open way. Dr. Levine, only 15% of the population has had an oral examination. How can that number be so low?
Yeah. I mean, oral cancer is on the rise. We see low-risk people not drinking alcohol, people not smoking, coming down with these oral cancers in young people. We have to get, number 1, of course, into the dental office, demand an oral cancer screening. So the dentists have to get ahead of this, and we have to be able to diagnose earlier, not wait and see with some of these lesions. The good news, we have some new technology to help us with this. But the dental office is really our first line of defense when it comes to oral cancer.
But Jonathan, why would it not be automatic? Why wouldn't every single dentist always examine their patients?
Yeah, it should be. It really should be. And the dentists need to catch up with this. Our patients, the consumers, everybody needs to understand what these lesions are. What are they looking for? They look so similar to the everyday red and white spots that people can get. Like my old pathology professor used to say, the eyes do not see what the mind does not know.
Right.
We have to know what we're looking for, and that goes for both our patient consumers and the professionals.
Yeah, that's why we're doing the show today. Because at its very core, you have to change the way dentists and doctors practice. If we don't do it together, it ain't going to happen. And so we're going to teach you a little bit about what to look for, because you can find this cancer on your own. Because it's cancer that's not on your radar screen, and it's not on our radar screen either. So, Melda, come join me if you don't mind.